Good afternoon, and welcome to this installment of the Center for Politics and Governance's speaker series. We're really delighted to be able to welcome Jim Capretta to Austin, to UT's campus today. I'm Ryan Streeter. I'm the director of the center, and as you know, we host a speaker series across a wide number of issues on public policy and politics. If you're not on our mailing list, please see Lauren and Hannah in the back before you leave so that you can get notices for our future events. I'm really pleased to be able to introduce Jim Capretta to you today. Capretta is a senior fellow at the Ethics and Public Policy Center in Washington, D.C., and a visiting fellow at the American Enterprise Institute. And I should note that the student chapter of the American Enterprise Institute is a co-host for today's event, and so we appreciate the co-sponsorship of that group. Being a visiting fellow at the American Enterprise Institute means you walk 2 blocks from one office to the other. Yeah. It's a pretty easy visiting fellow gig. Yeah. Jim Capretta has been working on healthcare policy issues for more than 20 years. He ran the healthcare policy office at the Office of Management and Budget in the White House for a number of years, and is widely regarded in the Washington, D.C. policy community as an expert on healthcare entitlement programs and related policies. I'm also pleased to be able to welcome Dr. Jacqueline Angel from the LBJ School with us today, who is going to provide a response to Mr. Capretta's remarks. She also has a long history of looking at these issues related to entitlement healthcare programs across demographic groups, and so we appreciate you sharing your expertise with us today. So without further ado, I'd like to welcome Jim Capretta to UT, and we'll turn it over to him.
Thank you, Ryan. Good afternoon, everyone. Thanks for coming today. I'm glad to be here. Wish I could stay longer, but it's a nice quick trip, and certainly great to be part of the center and their speaker series. So thanks for having me. So this might be called in the current political environment, a talk that kind of runs a little counter to some of the prevailing talking points you might be hearing on the campaign trail. If you've been paying attention, you might have heard once or twice that there's no problem, that we actually can leave these programs alone and maybe solve the budget problem by taking care of waste, fraud, and abuse. That's always a favorite target. Foreign aid, we all like, that always resonates with the public. And sometimes they like to throw in, we want to cut waste, fraud, and abuse. We want to cut foreign aid. And then for good measure, they say, why not cut congressional pay too, And if we just did those 3 things, everything would be great fiscally. And my talk today kind of runs directly counter to that kind of thinking, because what it's really about, the title, War on the Young, Why Younger Americans Should Favor Entitlement Reform, the point is really to bring home that we can't solve our fiscal problems with that kind of program. And the main victims of an ill-advised fiscal policy are young people. Actually, they're paying for it today, and they're going to pay for it in a huge way. The young people, maybe your children, the ones that follow this current generation, will pay for it in an even bigger way, unless we start to take some rational, not so hard to take steps if we were discussing these things in a kind of reasoned way. So that's sort of the backdrop to what I want to talk about today. Now, my slides are really just intended to kind of get us into the conversation and provide some background points so we're all oriented around the same basic questions. Fundamentally, what we're looking at in the United States and in every other advanced industrialized economy is a massive demographic change, okay? Unprecedented in its scope, to the degree of aging that's going to occur and is underway and will occur rapidly over the next couple of decades. It starts, of course, with the population over the age of 65, okay? So this is the population that will be drawing benefits, is drawing benefits today, mainly through Social Security and Medicare, and will draw in the future in even bigger numbers. Obviously, the bulge here in the middle is the retirement of the baby boom generation. We've been talking about it for decades. In fact, just to betray a little bit of my age, when I first came to Washington in the late 1980s, I started working on some of these programs, and I would hear people and the actuaries who were looking at it say, boy, oh boy, we got this big tidal wave of baby boomers coming. And people would say, yeah, but that's 30 years away. You know, we'll get to that. We'll fix it before we get there. Of course, nothing essentially has happened, hasn't been fixed, and we're at the beginning stages of the retirement of the baby boom generation. And one of the things that actually frustrates me more than anything else is when I hear people who I know for a fact oppose reforms in the 80s, the 90s, and the 2000s, essentially say, ha-ha, it's too late. You can't reform the programs because they're already retiring. And so the only solution is to raise taxes even more, okay? That's really frustrating because it's essentially delay and procrastination has gotten to this point where, yeah, we are a little bit in a box because they are starting to draw benefits and it's hard to change abruptly. The other side of the coin, so you have a rapidly aging population. The other side of the coin is the fact that we have changed family patterns in the United States. We had obviously the big bulge of births in the post-war era. That's the baby boom, but then it had a rapid decline. And essentially we're at a level of hovering around 2 total fertility rate. And that is really well below the historical norm for a long time. And it makes it so it's the working age population in most advanced industrial economies, including the United States, is not growing as rapidly as the population that will be drawing benefits. So you and your cohorts, your generation is bigger than previous generations, but not so big as to handle the burden associated with financing benefits for your parents and your grandparents. Let me just, I wanted to note before I got off of this previous slide, to quantify it just in number terms, from roughly 2010 to roughly 2035, we'll go from 40 million people aged 65 and older to 80 million. Okay, so that's a big jump in about a quarter century. Okay, so that's the bulge that we're trying to address in fiscal policy. Now, this is the combination of the two. Okay, so this shows you, yes, we've got people that are going into the programs in greater numbers as the baby boom retires. We also have, as I indicated, fewer workers, or not fewer, but a slower pace of people coming into the workforce because of a lower fertility rate than we had in the past, rate of growth, I should say, of the workforce. And so the combination of those two basically means we go from 1970, we had about 5.5 workers paying into the Medicare program for every person drawing out, okay? And if you just look at to where we are today in 2015, we're probably at about 3.5 workers for every person drawing Medicare benefits. And if you go out into the projections, 2030, 2040, 2050, obviously we're around 2.25 or so, okay? So that's a big shift. So you got a lot more spending burdened on a relatively, not absolutely, but relatively smaller workforce. And then just to round it out with one other factor here, and then we'll get into some of the other dynamics, but the other factor is, of course, in the United States particularly, we have a fragmented and very diverse system of health financing in the country. And because of the way it's set up and lots of cross subsidies and so on, healthcare costs have been growing very rapidly relative to GDP. So we have, through the Medicare program primarily, a lot of elderly people who are entitled to benefits for healthcare. And if healthcare spending in Medicare goes up faster than GDP, and you have demographic wave of a lot more beneficiaries, you got a double whammy occurring in the healthcare programs, okay? Medicaid is the program for low-income Americans, but it also covers low-income elderly, especially through the services provided in a nursing home. So both Medicare and Medicaid, their spending has gone up a huge amount because of rapid growth in healthcare spending, and then you throw into the fact that there's going to be serving a lot more people, you've got the recipe for a major fiscal situation, okay? Sort of the perfect storm. And that's reflected really in this chart here. Kind of brings it all together, I like to think. And so Basically, on this chart, you can see it's a stacked chart, and down here in green is Social Security. Here in maroon is Medicare, and in the blue is Medicaid. That's the program for low-income Americans. And then prospectively, it also includes, the blue part includes the subsidy structure under the healthcare law, the Affordable Care Act. So if you go back in time, back to 1972, and you just say, how much did these are sort of the big three that people talk about in terms of entitlement spending. If you go back in time to 1972, the combination of these three programs cost about 4.4% of GDP, okay? Sometimes hard to get people's mind around GDP, okay? But GDP today is, I think, help me out, Ryan, $18 trillion, something like that, okay? So 1 percentage point would be about $180 billion in today's terms, okay? So 4.4% of GDP today would be a lot of money. Okay, and it was a lot of money, relatively so, back in 1972, all right? And then you go in that top line there, that dotted line across the top, that's an indication of how much the federal government has collected on average in revenue over the last half century, okay? And it's basically been about 17.7% of GDP, okay? So if you're spending on these big programs about 4 percentage points or more, you still got a lot left over. You know, you still got 14% of GDP to spend on all the other things the federal government's going to be doing, like having a standing army and a navy, okay, and an FBI, and road programs, and you know, all the other things the federal government does, okay? Fast forward to where we are today, 2015 and 16, we're at about 10% of GDP on these big programs, okay? And you might ask, that's a 6 percentage point of GDP shift, okay? So in today's terms, that'd be like $1.2 trillion, okay? It's a big, big change. Where did the money come from to pay for these big entitlement programs if revenue is still roughly 18% of GDP? Well, it came primarily from one source. There's a number of sources, but the biggest source is a massive drawdown in national security spending. If you just go back in time and look how much the federal government used to devote to defense expenditures, obviously we fought a Vietnam War, which was very expensive, and we had a Cold War with advanced security in Europe that was a massively expensive enterprise, and much of that has been drawn down to near zero, okay? So defense today is literally 3 or 4 percentage points below its historical average when we were in conflict with the Soviet Union. And all of that peace dividend essentially has gone to the entitlement programs. Okay, so it's been spent and more. But if you just think, why are we running fiscal deficits today? If you think about that, why are we running fiscal deficits today? Why are we asking young people to pay more and more taxes? It's really related to the fact that we've got a huge amount of spending associated with these programs, and our historical political commitment, how much can we extract from the public to pay for programs, has been hard to get above 20% of GDP. Every time it's gone above 20% of GDP, there's generally been a tax revolt saying we need to cut taxes. We're asking people to pay too high taxes, okay? So it's been, you know, a difficult proposition to say we can just let these entitlement programs grow and still retain some tax level that has got widespread political support. Now, obviously, going forward, it's going to get much worse because of the demographic shift and healthcare spending expecting to grow faster than GDP. If you get that going, as it has in the past, and you project it out to the future, this is from the Congressional Budget Office, essentially the combination of these three programs is going to eat up, you know, 80% of all federal revenue, okay? So this is when people talk about the need for entitlement reform, this is really what they're talking about, okay? This is the combination of things that means that either we are going to have to raise taxes a huge amount to keep the programs as they are, or you're going to have to start making reasonable adjustments. I'll talk about this very quickly, and then we'll get more into the specifics of the programs and how it affects you and young people generally. This is just generally a point about pre-committing federal dollars and how it affects programs that you might care about. Back in 1965, 2/3 of the budget was what we call discretionary, meaning that every year the Congress, through its appropriations process, would decide how to divide that up amongst a bunch of programs. So 2/3 of the federal budget, in some sense, could change relatively easily based on new priorities, because Congress was going to make a new decision about it every year. Okay? So 2/3 was a lot of the budget. Fast forward to today, about 1/3 of the federal budget is discretionary, and that includes all of defense and all the other smaller programs that are called domestic discretionary programs. Okay? So about 1/3 of the budget now today is really subject to Congress saying, we want to put more money here, we want to put it there, or making some choices about priorities. The other 2/3 of the budget, or 3/5, 62%, is for these big entitlement programs plus, okay? Farm programs, anything that is on autopilot, where the money is being spent automatically, absent a change in law, okay? So the money goes out the door automatically unless Congress intervenes to try to stop it. That means, essentially what that means is that for all the things people worry about a lot, infrastructure in the United States, education, crime, health research, these things, there's a lot of discussion in Washington all the time that these programs that would help on some of these major priorities are underfunded. Well, one of the big reasons they're underfunded is because so much of the federal budget has already been pre-committed. There is no discretion left. There is no maneuvering room to say, hey, a big new priority is come along and we need to devote new resources to it. I mean, just think of you know, the Zika virus, frankly. All right, so this has emerged on the scene in the last year. Nobody really, I mean, best of my knowledge, I didn't hear a lot of people say they saw it coming. And it's actually a huge public health crisis, right? And so resources are going to have to be devoted to addressing it and turning its tide, you know, getting it headed in a better direction. And frankly, the usual scramble, you know, there's a big scramble underway right now to try to find and cobble together resources to try to make that happen. If in a budget where there would be more discretion and more flexibility, you could do this much more easily than I'm pretty sure they'll be able to do this year. All right, so let's talk a little bit more specifically about where we're going and why this is really important to you and to your colleagues in cohort. Social Security. Social Security is a big program, important program. Many people are dependent on it. Okay, so I think its beneficiary population is now low 50 millions. I can't remember the exact number. Okay, most of them are elderly. There is a big disabled population on the program. You pay payroll taxes today. That funds essentially the benefits that are going out to the beneficiaries today, but your payroll taxes entitle you to a benefit when you become retired or disabled. Okay? So it's a pay-as-you-go program, intergenerational. But because we have a big demographic shift that's occurred, what's going to happen, based on past practice and likely future course of political action, is that the people today are enjoying a certain level of benefits, but it can't be sustained because of the demographic and cost structure change. And so that top line is the cost structure. That's the cost, you know, of the program going forward. And then the reddish or maroon line is the expected income from the payroll tax at its current rate. Okay, so it's pretty obvious that there's a big, large gap there, and adjusting it means that essentially you're going to pay a higher rate of taxation for a lower benefit. Okay, so one thing to keep in mind here is that you can't keep the program going on its current schedule. The promised benefits will not be payable without a big adjustment, and that adjustment is going to make the program even less attractive, frankly, for the people paying into it today, especially depending on what's done. And an illustration of that is seen in this chart here. This is a chart that shows a combination of the top line is based on birth cohorts, actually. Excuse me, this is the year of retirement. So people that retired in 1960, they paid about this much in lifetime taxes and this much and they got this much in lifetime benefits. So that's a pretty good, gap. They probably made about $200,000 in net lifetime benefits for the people that retired in 1960. They paid a very low tax rate in the early years of the program, and they got a pretty generous benefit in return. Okay? That delta between what you pay in and what you get out has been narrowing over time. There's a famous series of papers done that essentially said that the key to Social Security was that you could pay a rate of return that was positive and above sort of the natural interest rate that might occur on other investments, because of population growth would allow a higher payout in the future than it had in the past. Okay? Of course, they didn't bank on the fact that you'd have this plummeting birth rate that would mean that the people coming into the program weren't as high as they had anticipated, and so you couldn't pay out such a high rate of return. And so what's happening now is that those two lines are narrowing between what you're getting in and what you're getting out. And pretty soon, when the adjustments are made to try to make the program actually solvent, those lines will cross. And for a time, a generation will have to pay in more than they will get out to make it solvent. Okay? And that might be your generation. So that's the prospect here in the future. Now, another way of looking at it is from this perspective, which is another way of kind of saying the same thing, which is that how much do you earn back from your Social Security contributions? And it's a complicated calculation, but they did it at the Social Security Administration. And it's essentially, internal rate of return. How much did a cohort pay in, and how much did they get out based on that contribution to the program? And you can see that for birth years going back to the early 20th century, they got a pretty good rate of return, right? Because it was a pay-as-you-go system, and they started the program essentially in 1940, right? And people paid very, very little and started drawing benefits immediately. By 1945, 1950, there were millions of people on the program. They paid hardly anything into it, but they gave them benefits. Okay, and so that continued on through the 50s and 60s, and so the early years of the program had a huge cohort of winners, and that continued on even into the early baby boom. But now we're getting to the point where the internal rate of return is below 2%, which is quite below what people would probably be able to get if they invested it privately. Okay, so to some extent, as people look at the program, if you hear the argument, hey, it doesn't seem like a great deal in terms of what people are getting out, it's based on this calculation that shows a lot of people. This is on average, obviously, across a group, and it differs by people's circumstances. But on average, across a large group of people, it's going to be below a 2% real rate of return, which is not zero, but it's still not above what people think they can often get if they were doing it on their own. Okay, so I'm going to quickly go through these last few points. I want to get to sort of perspectives on what we should be doing about this here in just a second. But a couple of other points specifically about the Medicare program and why it affects you today, and it'll affect you in a big way in the future. Something people don't really understand about Medicare is that it is not entirely financed by a payroll tax. Yes, you are all paying a payroll tax when you work that goes into the Medicare program. That will entitle you to a portion of your Medicare benefits when you reach age 65. But it doesn't get you the whole thing. There's another component. That payroll tax finances what they call hospitalization insurance, essentially any kind of institutionalized care. If you got to go into a hospital when you're elderly, this part of the program pays for it. But the other part of Medicare is called physician services or supplementary medical insurance. So it's for physician services and outpatient care, ambulatory care, things that are not in an institution overnight. And that is heavily, heavily subsidized by current taxpayers. Okay? So at the beginning of the program, they said, Well, we'll make the elderly pay for 50% of what that portion of Medicare costs, and we'll contribute 50% from the general fund of the Treasury. Okay, so it's subsidized at about a 50% rate. They abandoned that very quickly, and it's been now at about a 25% contribution from the elderly and a 75% contribution from general taxpayers. This is a big deal because as Medicare, as I told you early on, Medicare has exploded in costs, okay, over the last 4 decades. And so this is just a measure of how much we pay in as a country in income and corporate income taxes, both individual and corporate income taxes, and how much this subsidy that I'm talking about has gone to just covering Medicare costs. Okay, so you look at all the income taxes people are paying, individually and through the corporate system, and you say how much of that is essentially implicitly devoted to covering this subsidy for the Medicare program. It's up to 25%. Okay, so 25% of all income taxes, in a sense, are kind of going to this subsidy for the elderly. That's a big portion of what every working family is paying in their income taxes. Now, that also is scheduled to go up very rapidly in the future with the retirement of the baby boom generation and further healthcare cost growth. Okay, so couple last points, and then I want to get into some policy matters. But so Medicare is now has an unfunded liability of about $50 trillion. Okay, so if you understand that the payroll tax that is covering Medicare's costs only covers a portion of the program, and you say how much is going to have to be coming out of other taxpayer funds and is not covered by the payroll tax, it adds up to about $50 trillion. Okay, this is the subsidy for the physician component of the program. This is a big subsidy for the drug benefit that was just added in 2003. Okay, I plead guilty. I was in the administration when this benefit was created. And we'll talk about that later. But basically, it adds up to about $50 trillion. Okay, so there's a big looming problem with financing this program that unfortunately is going to affect you and your taxes quite a bit in the future. Last slide, and then we'll just be more into the policy side of this. The net Medicare subsidy, this is similar to what we just looked at for Social Security, but again, my point basically is this is the subsidy that people get. This is people that turned 65 in 1960, and then 1990, and then people turning 65 today. Here's the net lifetime subsidy people are getting from the Medicare program. Basically, here's how much they paid in payroll taxes, and here's how much they get back in benefits. It does not count, this calculation does not count their income taxes. Okay, so yeah, these people were paying income taxes that helped finance their parents' Medicare program, but this is just a strict calculation of the tax dedicated to Medicare less how much people are drawing out of the Medicare program, and the premiums also that they're paying for Medicare. Okay, and so again, it's been going up. Now, unlike Medicare, unlike Social Security, maybe this is good news for you, right? So yeah, we're going to get a great big subsidy, okay? Because the subsidy isn't tailing off like it is in Social Security. It actually is going up, okay? But of course, this presumes that you can just continue on with sort of massive unfunded liabilities in the Medicare program indefinitely, which is not realistic, okay? So that probably will have to tail down. It's just a question of when. So that's all the doom and gloom portion of the program, and now we'll turn a little bit toward what would one do about this? When I do a presentation like this, generally I'm self-conscious of people thinking to themselves, and some of you are probably thinking, well, gee whiz, what are you going to do about this? This is such a huge problem. Is there any way out? And I don't think there is an easy way out. Okay, there is no silver bullet. There's no magic to this that's going to make it easy for the country to adjust its way to a stable solution. When you hear politicians say, don't worry, it's going to work out, then you should be worried. Okay, what needs to be done? It's actually a series of things, but I would start with the fact that we need, as a country, to recognize demographic reality, which is actually not that hard to do, okay? If you think about it, we've set up a system, and many other countries have done this similar in their structures. We set up a system that essentially says to people as they plan their lives that you can have 25 or 30 years of retirement. That you don't have to work those years, that the system will be set up to allow you to exit the labor force, and a system of social protections plus your own savings will allow you to enjoy your retirement years for that many years. Well, that is fine if people do it on their own dime, okay? But it's probably not possible for us to subsidize people for an ever-lengthening retirement subsidized by taxpayers, right? I mean, I think that's the question. And so if we are living as we are 5, 7, 8 years longer than we were 4 and 5 decades ago, then we have to make some adjustments for how long we can subsidize people, middle-class people and upper-middle-class people, into their retirement based on asking taxpayers who are younger and struggling and trying to pay the bills to cover their retirement. So we need to have a rational understanding of what's an affordable, subsidized retirement. How much can the taxpayers be asked to subsidize in the length of time for retirement? This essentially means, yes, changing the retirement age. Would it be actually catastrophic? I don't think it would be. To say, let's recalibrate the basic understanding of when people go into Social Security and Medicare so it's closer to 70 rather than 62. A lot of people are still getting on Social Security at 62. So that's point number one. The second point is, why don't we start recognizing, and this runs really counter to some of the conventional wisdom, why don't we start recognizing that the system of financing these programs is very difficult for younger people? So you've got a lot of people coming into the labor force, age 16, 18, 20, 25. They're already paying a very large payroll tax on earnings that probably won't even count toward their benefits when they retire, at a 12.4% rate for Social Security and a 2.9% rate for Medicare. That's a big payroll tax for someone who's working a very, part-time job at age 16 and 17. Why are we doing this to young people that way? We should recalibrate when people start paying the taxes, who should be paying them, and at what level, so that they aren't so punitive on entry-level people coming into the workforce. And the third point to make is, and this is the biggest one, is we're going to have to target resources on people that need them. Okay? Social insurance, as designed through Social Security and Medicare, came in with a understandably and very popular concept, which is that everyone participates, everyone pays the payroll tax, and everybody gets something out of it. Okay? So that meant even middle-class people and upper middle-class people paid into Social Security and Medicare, and they get something out of it. It's a little bit less under Social Security than a lower wage person, but they get something out of it, even subsidized to some degree by intergenerational transfers, and particularly through Medicare, they get a lot out of it. Okay? And so we're going to have to rethink how we target support under the programs so that we really have these programs at an affordable payroll tax that doesn't crush the next generation. Okay? That means in Social Security, we are going to have to start thinking about Social Security as something that is providing a more floor of support for everyone. Everyone would get it. It would provide better protection against poverty, frankly, than the current program. But it would be flattened to some degree so that some people that are better off, yes, they would get this flatter benefit as well, but they'd be expected to save even more privately for their own retirement, which they can do. Their payment into Social Security, in effect, would be a real insurance premium, in the sense that they would be protecting themselves during their working years against poverty and old age. But if they weren't poor during their working years, they'd get this flatter benefit, and the expectation is they would save more for their own retirement. Is that really unreasonable? Probably not. The Medicare program has to do something similar, which is, if you think about it, what Medicare is doing is, and I'm going to wrap up because I definitely want to leave a lot of time for the respondent. The Medicare program is doing something similar, which is that you think about Medicare, it's got two components to it. Medicare says to the population, when you reach age 65, we're going to give you a guaranteed community-rated insurance plan that you're going to be pooled in with everybody else. Okay? That's a huge benefit. That gives people a lot of security. They know once I reach a certain age, I'm in a secure health insurance plan that the government has helped organize, and it means that I won't be treated badly based on my own health. Okay? So that's a big benefit, and I don't discount that. I don't think we'll ever get away from that. That's the biggest value Medicare provides. But then it has a second component to it, which is it taxes you when you're young, and then says, well, when you get to old age, yeah, you'll go into this Medicare insurance program, but the taxes you paid in effect, kind of prepaid your premium. Okay? And we will allow you to go into the program at a discount based on that, plus we'll subsidize it from general taxpayers, as I showed you earlier. Okay? We're going to have to rethink some of that too. Okay? There's already been quite a bit of movement toward income testing in Medicare to make higher income people pay. But I think there's going to have to be a general, broader understanding that, hey, people, when you plan for your retirement, that planning is going to have to include paying some more of your own premiums for your health insurance if you've made a wage sufficient to save for yourself. Okay? And then in Medicare, we will target the subsidies on people who, yes, had a very long wage record of lower wages relative to the average. That's a way to make the system still secure, still provide good insurance, but financed more from people planning themselves for their retirement rather than asking current taxpayers to subsidize middle class and upper middle class retirees as they are today. Let me see if I forgot it. Oh yeah, and then one last point on that, which is that we're only going to be able to make some of these things work, that is to recalibrate where we're subsidizing people and sort of renegotiating to some degree the implicit contract around some of these things, if it is easy for people to save for their own retirement. And for 60 to 70% of the public, it is pretty easy today. Most people have access to tax-preferred, low-cost, easy retirement savings vehicles, okay? But not everybody does. And so, especially for people working in small businesses and in firms that don't have the capacity to do a lot of this themselves, I'm not adverse to the government, federal and state, working to try to make much easier access to tax-preferred vehicles available to those people, even one that is sort of sponsored in effect by the federal government. I mean, a lot of conservatives don't like that idea, but I'm not adverse to an idea of some easy way to allow people to start saving for their own retirement, because I think it will take huge pressure off the commitments we've made under these entitlement programs if people know, yeah, I can prepare and plan for myself in a pretty easy way. This is a topic that can go in many different directions. It's got a bunch of dimensions to it, so we left a lot of things, I'm sure, unsaid. But I'll turn it over now to the respondent, and I hope there's time for questions at the end. Thank you.
Great, thanks. Thanks very much, Jim. Dr. Angel, please join me in welcoming Dr. Angel for the response. And if it's okay, can I ask you to just use the mic here? The handheld mic might be easier than trying to use the mic.
Well, welcome. Thank you so much for the invitation. And good afternoon, everyone. Your macroeconomic trends are very compelling, and they have serious and very important implications for the future. Your future for the millennials. As Jim said, it is the largest cohort in U.S. history, 80 million. Our Gen Ys could potentially make a lot of decisions in the future with respect to the status of these entitlement programs. I want to focus my remarks on the implications of many of the recommendations that you've offered. These policy prescriptions have been shared and discussed and debated by other groups as well. And I want to encourage all of you to, in fact, be part of that conversation, because one of the things that Jim's book does is he elevates the visibility of this topic of healthcare entitlements and Social Security entitlements. This topic for your age group is not one that is necessarily the most salient. Most of the Gen Y is focused on paying school debt, is focused on thinking about ways in which they're going to be getting employment, thinking about what are you going to take for your curriculum next semester, who is your roommate going to be. All these other issues are far more salient than in terms of entitlement reform. But I'm so glad that you're here, because we really do need to all be part of this conversation, because this is an intergenerational program. And it's been with us for many, many years, since FDR established it as a result of the Great Depression in dealing with poverty. Let's see now. Let's see, how about this way? Okay. So, discussions of Social Security reform. We're going to see, interestingly enough, I think more said about this when we have our new president put into office. Curiously enough, not only, frankly, are the young cohorts discussing this and debating it, but many other groups are not, including our presidential candidates in the primary. And Governor Christie from New Jersey, in fact, was one of the few who at least put it on the table during a couple of the debates, and he actually didn't get that far, which is interesting. This, we talked about Social Security. Medicare is really even a bigger problem, as Jim had pointed out. And I want to talk about the implications, particularly for certain demographic groups in terms of what these distributional effects are going to look like. We have a new world that's awaiting us, not only here in our state of Texas, but nationwide. And we are becoming a minority nation, as well as our own state, with 1 out of 3 of our citizens of Latino origin, particularly Mexican origin. 1 out of 4 will be of Mexican American heritage, and this accounts for about 2/3 of the Hispanic population. Why are Latinos such a key to entitlement reform? Well, when we think about the diversity of our nation, we have to consider the diversity of our labor force. And Latinos represent a disproportionate segment of that population. That's important, because we also know that Gen Y and Latinos in particular tend to vote at a lower rate than these other groups. So what will be the potential influence for how we're going to pay for all of these services? And incidentally, not just these entitlement spending. We have discretionary spending, even though it's a smaller piece of the pie. We have a military to support. We have to pay off our debt. And so if you look at that pie, we have to figure out how we're going to be able to not only pay for those services, supports, benefits, but who's going to be able to really benefit from them, who's going to, will we be applying means tests as we have to go through reform? And also, to what extent will there be undue hardship caused because of differences in one's life chances in certain groups? And that's what I want to show you now, because it could definitely undermine the health as well as the financial security of different groups. Our Latinos in particular, because they are at risk for many different economic and health problems. Having an accumulation of disadvantage has put our nation at risk for this population, because again, disproportionately, they are going to be providing the contributions to our entitlement programs. This population has extreme low levels of education, wealth, income. It also has more propensity to take care of parents because their older parents, do not have enough Social Security income. They participate in the program, but the benefit itself is far lower. It's inadequate to sustain a decent retirement. And we're just talking basic. Social Security, as we know, was designed just to provide a foundation of income. But because the Latino population does not have, or less likely that is, to participate in retirement plans, these are private plans, it cannot offset what that economic disadvantage is and that financial disadvantage. All of this, as we know, is important because our labor force, the kinds of skills we need, the kinds of employers and employees we need are going to require that we have these kind of supports. We also find that the Latino population is in a particular unique situation because their parents tend to not enter nursing homes. What does that mean compared to non-Hispanics? That means that the current workforce is going to have to take care of them disproportionately at a time when they are in occupations, disproportionately service occupations, those positions that are non-management do not have a lot of flexibility. And so that caregiving responsibility is going to, again, sort of magnify the challenges of growing old. And the question is, will they be able to afford to grow old? Not just the parents, but the workers themselves. Another unique aspect, and this is sort of one of our policy paradoxes, health policy paradox, when we think about what are the consequences of all these recommendations, is the Latino population, and more specifically the Mexican origin population, has a far higher life expectancy at birth as well as at age 65 than non-Hispanics. That means they're living far longer, but what accompanies that is also more disability. We know aging is associated with disability, but also because of all of these structural disadvantages, it places them at higher risk for dependency. Not only dependency on their children, but also on dependency on government services, which are shrinking and not expanding, because we have to figure out what ways we can strengthen these programs. There's actually a lot of shared a consensus with respect to these programs, both Medicare and Social Security, because we know this is a social, a collective program, it's an intergenerational program, and if you look at poll after poll after poll, on average, the American people do want these programs to exist. The question is, they cannot create a burden or a potential burden on our generations to come. And herein lies the problem and why we have to come up with solutions. At the LBJ school, where I teach, we end up focusing on that, not just defining what the problem is and bracketing that, but let's come up with some real viable alternatives. And we can do that. And Jim presented some to us, and we'll go into that. But just to point this out to you here, and this is just remarkable. We know women outlive men across all groups, but here we have our men outliving, both men, Latino men outliving non-Hispanic whites and African Americans. And for women, of course, this is a particular problem for Latinas because they have fewer resources, all right, across the board. Here's the data on education, graduation from high school, 57.4%. We have to improve those graduation rates because we know that this very much affects opportunities in the labor force, which is associated with the possibilities of being able to participate in a private retirement plan offered by employers. And it starts early. You know, when we planning for retirement, we have to think about it now, although half of Americans in the baby boom cohort are not thinking that way, so they're not even part of that planning process. Hispanics because of this increased, this large rate of the population that is of low income, high rate of poverty, they rely heavily on Social Security in the absence of having retirement, private retirement income. 53% of Hispanic beneficiaries relying on Social Security for 90% of their income. So this is life altering without these funds. So adequacy is a big issue here. It's not just being able to participate, but how adequate it's going to be. So these are important data. Again, we have a higher risk of lacking private retirement income because of the disadvantages in the labor force. And we've, my research with my colleagues and I have really documented this quite extensively using Census Bureau data. And even when one controls for the same occupation, there's a disadvantage. And I'd be willing to share that with you if that's of interest to you. So here, these statistics are very stunning. We have, even when offered, it being offered to take up private retirement plans, there's a lower likelihood of that happening. And often it's because there's larger family sizes a larger family size in the Hispanic population, and they just can't afford it. Right? So even though they're given the opportunity, it's just not possible. So what are we going to do about this? We have some excellent and really compelling policy prescriptions, and I want to just sort of flesh that out in terms of what, for this population in particular and for other disadvantaged groups, what this means. If we increase the normal retirement age for Social Security, this will have a potentially devastating effect on a certain portion of this population. Not only, as I mentioned, are Latinos, because they're living far longer, they are likely to have more disabilities with respect to being able to take care of themselves at home, being able to engage in shopping, physical limitations as well. So this is a problem. Also related to this normal retirement age, we know that timing retirement is also sooner because Latinos are far more likely to work in physically demanding jobs. So this is not an option on whether one wants to choose to work later. And interestingly enough, in the United States, more and more workers are retiring earlier, prior to age 65. At 62, you can receive reduced benefits. And a lot of individuals are choosing to do that. In many cases, for certain subgroups of our workforce, they are unable to make that choice. These are imposed upon them. On a positive note, I think what we can do is promote retirement savings. And I think this is what your third recommendation was getting to. But in order for us to do that, we first have to be in employment that provides an adequate income, so you'll be able to have a certain fraction of your earnings and salary devoted and dedicated to that. Employers need to step it up and try to reduce the penalties often that come with participating in a retirement plan, especially if you don't make the monthly payments. But I think this clearly is one way that the federal government, employers, and even the state can engage in trying to promote a healthy retirement security, and adequacy is what we're focused on here. We also know that financial literacy is a key to this for all groups, not just women. Women have sort of lower financial literacy on average, according to the data. We can all get better, start earlier, and understanding basic finances. One of the reasons we know that Gen Y is struggling these days is because these basics about managing a checkbook or your credit card and not really understanding what the loans are when you take out loans for your college education, what that all means. We can do a better job of creating curriculum that would help to educate us. Incidentally, 1 out of 4 of our state local workers do not participate in the Social Security system. These are civil workers who they work for the state or local governments. So when we think about Social Security and who's paying into the system, do we need to generate more revenue or do we need to cut benefits? All of these options have implications for this population. And then finally, increasing educational levels for this population in particular is something that we need to work very, very hard on, because this will, again, very proactively help to open up all sorts of opportunities. We need to also do some research, and some of you might be interested in this. I'm very impressed, by the way, for all of you being here and really trying to learn about this. We need to understand the underlying source of these disadvantages, income, education, and how they're linked to poor health, because we know that health and wealth, the Medicare program and Social Security, are inextricably linked. We need them both, right? And then also, we need to, just in conclusion here, craft these proposals so that we're going to strengthen them, right? Without the possibility of an unintended consequence of actually undermining or harming certain groups. And this is something we need to look at that deserves a lot more attention. And these two young girls are part of the foster care system that my neighbor is fostering about 2 years ago. And this is our future. This is the generation to come. But we don't have enough time now to talk about their life story. But I can tell you that this is really what we have to do as a society in terms of, focusing on everyone's health and retirement security. And it's not going to be just by one or two people. And it's not just the government's responsibility. It's all of our responsibility in engaging in that debate. So let me start there.
Great, thank you very much. Thank you, Dr. Angel, for your comments. And we can take a few minutes for questions. And if you could just speak up, if you have a question for either one of our speakers, I'll just ask them to repeat the question so that our viewing audience can hear what the question was. Anyone in the back?
Hi, my name is Samantha Kilgore, and I really enjoyed what both of you had to say. My question is if there's been any research about how health and work affect each other and how that might affect rates for Medicare and Social Security in the short term, because I think everyone knows that the goal of healthcare reform will be driving down these costs, but the health consequences of working another 3 years at a desk job, if you're sedentary and stressed out, or if you're in a factory and you might get injured, how could that affect Medicare costs in the short term?
That's a dissertation.
Yeah.
That's a really important question, looking at the health consequences of the Affordable Care Act. It's 6 years out now. We haven't really conducted the research, and it's certainly a fertile area, and we need to have better indicators and markers of the success of all of these entitlement programs. We have many, many years to evaluate for the Medicare program, and we know that it has not only improved the health of older adults, but has also helped family members as well, because they have had the kind of supports and security that their older parents need.
Yeah, I have a mic on. Thank you. I would just say that your question, if I understood it right, is let's say we made everybody work to age 70, and how's that going to affect their health into their retirement years if we make them work a couple of years longer? Is that sort of what you're getting at? Yeah. Well, two things. One is that the research shows that if, on the good news side, it's not directly answering your question, but the good news side is that every additional year of work after age 62 adds a huge amount to people's retirement savings. So if people can be encouraged to work past 62 to 63, 4, 5, up to 70, it'll boost their resources in retirement by a very large amount, okay? So that's the good news. The bad news is that we'd like to think that staying active and working might improve people's health, but there's studies going both directions, okay? But there are some recent studies that basically, I think, kind of go in your direction, which was people are stressed out on the job, and stress is a anti-health. And so there is some research that shows people are unhealthier when they work rather than if they were able to have more leisure, okay? But I wouldn't say, one has to kind of put that into context of what's the alternative. We'd all love to have a lifetime of leisure, right? I mean, great. So the question is, where can we, how can we encourage it without being draconian about it? I think is probably the way to think about it.
Other questions? Here in the back.
Vance again. My question would be, is there a way that we can get away from discussing this as being an entitlement? I think you're really only entitled, you're only going to die once, you're going to pay taxes overall, right? And so I think the idea that these are entitlements, that you have to have them, has changed, what are the behavioral effects of this discussion over time, right? I mean, if you expect your Social Security to be there one day, then that's going to change your saving behavior during your lifetime and you otherwise would have saved. Or you might have you make different decisions about your health because you know that Medicare is going to be there for you later on and somebody else is footing the bill. What sort of behavioral effects might there be over time? And what would some people, like those of us that are millennials, when you hear that Social Security is going to be bankrupt by 2036, what are some of these things that could change our behavioral patterns as we get older?
You go first, I can follow, yeah.
I was going to say that the millennials are already on top of this in terms of when we look at the data of age differences in support of entitlement programs. So your comment is well taken. And this is where I think we need to elevate the visibility of this issue so we can get down to business and come up with some viable alternatives for making it an attractive benefit for those, especially who need it most. And I think the key here, though, is entitlements. This is a social construction, but really what are we talking about here in terms of guaranteeing just a modest benefit for Americans who are superannuated and no longer working, as well as people with disabilities and their survivors and dependents. It's over 50 million people participate in the Social Security program.
Yeah, I just would add that I think you're on to something important, which is that first of all, FDR was a brilliant politician, okay, and his great insight from his advisors, but he seized on it, was that if you financed a Social Security program through a payroll tax, it would create a very powerful political coalition amongst people who said, hey, wait a second, I paid for this, okay? Because they know this money's been coming out of their paycheck every 2 weeks, their entire working life. And so when a political person or a policymaker comes in and says, we need to make some adjustments here, in their mind, they said, wait a second, I've been paying into this. You can't do that, I've paid for my own benefit, essentially, okay? And that, if you look at the polling data around Social Security, that connection between the payroll tax and people's expectation they're going to get it back in retirement is immensely powerful. And anybody who tries to step in the middle of that, they get their head cut off, And so that is, I think, a conundrum, okay, because it does need to be adjusted. And people don't realize, because it takes a half an hour presentation to sort of explain, it's true you're paid for some of it, but a lot of it you didn't pay for, okay? And so there's a difficulty trying to get into the conversation in a way when it's governed by politics, where it's very easy for a politician to say, I will never take away your Social Security because you paid for it. How many times have we heard that, right? And I think that generally wins an election, frankly. And so, having been at these things for a little while now, I can tell you that I think is the, central to the problem, okay? And until, I don't have a great deal of confidence it's going to be solved in the political sphere easily, absent some, crisis of some sort. Unfortunately, it's very difficult to envision. And maybe I'm a little pessimistic this year, more this year than most years, but it's not quite easy for me to envision how it gets resolved in a way that doesn't involve, hey, everybody, we got to fix this because it's headed toward a big problem. Anyway.
Well, I have. Okay, I was just going to say I have about 5 questions I'd like to ask. I think you probably do as well. We're going to have to wrap things up. I know there's another event in this room coming up. And I'd just like to ask you to join me in thanking our speakers today for this great presentation.